WION and CGTN bring you an exclusive report from the virus-hit city of Wuhan. Listen in.
Well, the lower death rate has a lot to do with the severe condition treatment, given the fact that the Chinese authority has carried out six updated versions of the treatment plan. So they are targeting the patients with severe condition, and the decrease of the death toll really has a lot to do with the efforts of that. But I'm not going to say that this is a turning point or anything than that, because experts never claimed that on one hand, and on the other hand, there's a common sense among a lot of the Chinese people over here. As long as this is not the end of the epidemic, they will never treat this as basically getting better or anything else. So people are still insisting till the end of the epidemic. Well, actually, that's also a good sign, because you can get a sense that this is the coronavirus, the novel coronavirus, is threatening because it has a very high infection rate, but at the same time it has a lower mortality rate, and it has a lot to do with people's immune system, according to the medical experts. So also, due to the fact that the currently medical workers have not figured out scientists have never figured out the source and ways of transmission of the novel virus. It's all under suspicion. When they're not figuring out this, it's still too early to figure out the vaccine, maybe other strategies to kind of cure the virus. So far, what they can do is to cure the symptoms by itself. But the good news is, as soon as they got discharged from the hospital, technically they're recovered, but they will not go home immediately. For security reasons, they will be transferred to a relatively safer zone for another 14 days, another relatively quarantine zone. And those quarantine zones are renovated from schools or hotels, and they'll be taken good care of for another 14 consecutive days before they're really discharged to go back home. I think in the long run, it's for the sake of Chinese normal residents, people are definitely have more experience in treating or dealing with epidemics, especially epidemics with infection diseases. So before people got to know what really the details about the novel virus, the only thing that they could do is to get oneself quarantined and reduce the human-to-human contact, and then it's very effective, even though we have not too much knowledge with the virus, but it's very effective. So I think in that way it's a good point. But certainly, from the economic perspective, due to the shutdown of the city, 2 weeks, more than 2 weeks, well, actually a month, the city has been suspended for over a month. So economically, a lot of medium or small companies have enduring a big strike, but also at the same time, the Central Bank of China has also provided more mortgage for medium and small enterprises. Well, so far, the Wuhan epicenter of the coronavirus outbreak has just finished the most strict or door-to-door, all-scale screening, meaning that community workers will knock on each single household and check their temperatures. If they discover anything with fever symptoms, they'll be advised to go see a doctor. So far, all the people staying at home, technically, they're healthy. So now they got quarantined with their other communities. Each household only have one quota every 3 days to send a member to go out and do shopping. So by that point, this is a very brave measurement, given the fact that it is a kind of a completely reduction of human-to-human interactions. And if the city of Wuhan keeps this status for another 2 weeks or so, maybe we could see some effect there.